Wednesday finance meetings. Commissioner Cross is out sick. Commissioner Eichenberger will be joining us in his customary, not quite on time manner, hopefully within the next few minutes. So I thought we could get going. But we use these sessions for a discussion of the county's efforts to try and reconcile its revenues with its costs. Part of a lot of our effort in these meetings is focused on recommendations that came out of the EFM study. Clearly, the criminal justice system and the prison were both highlighted in the presentation and findings of PFM, potential sources of reduced costs and in some cases some marginal increases in revenue. But a lot of thinking has gone on since then, particularly with the criminal justice policy steering committee. And they are here today to talk about expanded intermediate punishment, or IP as it's lovingly called, and in-house electronic monitoring, which is not about jewelry, ankle bracelets, so not the traditional. So without further ado, I'll turn it over to Rebecca and the representatives from the committee here today.
Okay, thank you.
I'm pleased to be here, by the way.
We're pleased that you are here, or I would feel very silly. This is an idea that Dave Freed and I gave some attention to at the last prison board meeting. And at that time, after we went over the general concept, we did promise to come back with a more thorough look at what the investments versus costs benefit would be if we considered moving forward with this. So, as a group, we fleshed out.
We just started. You missed my thrilling and enthralling introduction.
In other words, I missed nothing.
No. You missed the most important part of the presentation.
Oh, thank you.
Well, I'll fill you in.
Okay. Excuse me for reading my
Okay. I was just saying how we had gone over this a little bit at the prison board, and we're here with an expanded version with a little more cost details involved. We've been looking at expanding intermediate punishment for a while, but technology and staffing has kind of prohibited us from doing that. Fortunately, the technology has moved along such that we don't have to travel to an offender's house to hook them up on the bracelet anymore. It's a simple 15-minute hookup inside of the office these days. And the costs have dropped significantly on the bracelets as well. So what we're proposing to do is expand the intermediate punishment to all of the DUI offenses. Currently, we had just begun to offer them to 30-day offenses. These are mandatory sentences. And previously, we had offered it, and still do, to 90-day and 365-day offenses. We'd also like to explore today with the group bringing in-house electronic monitoring for 1543A and 1543B driving under suspension cases. Through a series of events where the MDJs had approached Judge Cass about being able to utilize electronic monitoring in these cases and using a private agency, we've come to the decision that it would probably be best, and I have some more information on that later, to bring this service in-house. And
Rebecca, could you, before you go on, could you just describe the 1543A and 1543B? And it's driving under suspension. I understand
Yes.
what that is, but what are the two?
there are two different sections. The A is just for driving under suspension for certain traffic offenses, perhaps speeding, etc. The driving under suspension in 1543B is a DUI-related offense. You don't have to have any alcohol in your system at the time. Just driving under suspension for a previous DUI would get you charged with 1543B.
So on one hand, those who would be eligible under this, that would be, if they had their license suspended for some traffic violation, and/or if they had their license suspended for DUI.
And they have fairly significant mandatory sentences, 30 to 90 days, depending on the number of offenses. And adult probation, utilizing the electronic monitoring as a sanction for cases that are facing revocation, rather than move to a revocation process. They would put the offender on electronic monitoring, keep them attached to community services, etc., and not have to move immediately to reincarceration. So here's some more detail about the cost benefits of moving towards the proposal. These are estimates for what the annual numbers of defendants would be diverted from jail and the estimated bed day savings for each group. So our first target would be the DUIs. And conservatively, we estimate at 350 defendants. I say conservatively because there really are more like 420 persons in this category sentenced, but we try to account for those who may live out of the county or not otherwise be eligible. The 1543A is based on last year's commitment data to the jail. There were 50 defendants sentenced to incarceration for 1543A. 30 days each, so 1,500 bed days. The Bs, 50 as well. They carried 60 and 90-day sentences, so more bed days of 3,480. And a reasonable conservative estimate on the number of revocations that we might use the sanction on, we're going with 50, based on the number of gag non-waivers we have every year, which is significantly more than that. And conservative estimate is 3,000. Those gag non-waivers generally spend about 104 days in jail. We went with 60 just to give a conservative estimate of what might happen. So the total number of defendants targeted would be 500, and the total estimated bed day savings would be over 10,000. Okay, so some of the benefits that we think that moving forward with the proposal would produce: at a rate of $72.25 a day for the cost of a bed at the prison, that's $747,860. Additionally, we feel it's a good risk management tool. A lot of the DUI offenders aren't there very long. These are 48-hour, 72-hour, 5-day cases. That puts a lot of pressure on the classification unit. Sometimes they don't move out of classification before they're released. But by their admittance, they have to have a health care assessment performed. Some persons, particularly perhaps in the revocation category, might require detoxification. And it would offset some of the additional utilization of CCP based on our current service of common pleas warrants for fines and costs.
So can you go back to that for a second? So I'm anxious to hear what Earl has to say about these things here, the detox costs and stuff like that.
Well, when you talk about that piece of what's on that slide right there, it's all about risk management. You've heard me say many times at prison board, about my concerns about the sheer number of people coming into the jail that are detoxing. And those folks utilize a lot of staff resources. So we're figuring if these folks, if we're using electronic monitoring more, the jail's not going to see them, and we're going to lessen liabilities. Because it's just a matter of time before something goes south, with one of these folks we're going to detox. The percentages are just against us. As far as taking pressure off the classification units, everybody coming into the jail spends anywhere from 3 to 5 days in the classification unit before they go anywhere else into the jail. And during that 3 to 5 days, they're going to receive a physical. They're going to be interviewed by our mental health staff, the drug and alcohol staff, and the security staff. And those interviews will determine treatment needs and custody levels during the remainders of their stay there. Oftentimes, especially Fridays, Saturdays, Sundays, and Mondays, those housing units are at maximum capacity plus, because typically the 48-hour DUI convictions, 72 hours, that's when they usually self-report. So that would end up taking pressure off those housing units, especially during weekend periods.
Okay. And Rebecca, could you just go into a little more detail on that last point about explaining the CCP emissions and what the offset is here?
Well, I was talking about the process that Earl just was speaking about. But just in the first 20 days, I think, of warrant service for fines and costs, there were 35 admissions, 35 warrants, maybe a few less offenders than that who had multiple warrants. So those persons are being admitted and going through the process, and by taking out the DUIs that currently are being admitted, we're sort of offsetting this new program.
Offsetting them evenly, you think? Or?
Oh, well, I think that'll depend how many people actually have to be taken to that remains to be seen.
And I'm sorry, CCP stands for?
Cumberland County Prison.
Are we going to see any estimated quantification on this? I mean, I know you just went through
On the risk
on the risk
management?
management. Estimates of some type to give us a little more context on the financials, the actual.
Well, I mean, I could work on that.
Just roughly, I know there's a lot of detail there.
Well, it's 500 people that would not go through that process, that quantification.
Is your medical provider charged per screening?
They do not, but I can have time here to maybe do some case studies on those files and maybe.
I'm not looking for anything really in-depth, just
No,
something
right.
that I can add to this other number for, total cost. Rough, just rough.
This could have an effect further down the line by implementing intermediate punishment for the DUIs. Currently, we have difficulty between the time of guilty plea and sentence, getting offenders to have their drug and alcohol evaluations completed. And often this will result in revocations post-sentence. We estimated that 85% of the revocations on any given day might be due to this. So by implementing intermediate punishment, that process allows us to make sure that the DNA evaluation is done ahead of time, and that would eliminate a great many revocations on Tuesday's court day, and free up a lot of staff time for garbage 2 POs who deal with DUIs.
And this is a toss-up. I mean, this is a lot. So how bad is the situation about the evaluations done in a timely fashion?
It's bad.
It's really bad. Right? You know, we have some horror stories about that, about people taking a really long time, having to sit in.
We frequently will get the call, but we hear about it from our providers as well. Currently, most of the DUI evaluations are done by our contracted provider network. And a typical scenario is somebody will call and say, I need an evaluation by the day after tomorrow, or on Sunday. And so I think that the probation officer does their job, but we have a lot of our offenders that just simply procrastinate till the last minute. And it's not possible for the provider because they're booked to schedule within the next day or so.
It's not some, I'm sorry.
And it affects the court on the back end. I know miscellaneous court, we've had as many as 50 revocations, with probably 60-70% of those revocations being DUI cases that didn't get their evaluation done. So they're appearing for court for revocation purposes, appearing for the court, stay in court time, and really there's a pretty backlog with miscellaneous court.
And correct me if I'm wrong, but generally when they come in on a revocation like that, does the judge just continue that and give them another 30, 60 days, whatever, to do it? So not only have they been dragged into court, the judge then just says, okay, you really need to get this done, and continues it to another date, which means we're scheduling it for another date. If they don't get it done by then, we're repeating the same cycle over and over and over again. Because again, we generally don't want to throw these people in jail for not getting this, but it has to be done by law.
There had been some confusion. I think different people had different opinions about whether legally had to be done prior to sentence, but recently, I think in Commonwealth versus Taylor, it was decided that it is not a legal sentence without the drug and alcohol evaluation, and the burden is not on the defendant. It's the court's burden to not impose a sentence until it occurs. So moving on to point number 4, by utilizing the electronic monitoring and probation, it gives them an additional tool to keep offenders in the community and engaged in services rather than being reincarcerated, potentially losing employment, potentially having to start over treatment. So we feel that that would be something beneficial for probation.
And that also, I think that gets back to the point you made on the other side, that enhances the probability of being able to collect more than cost fines, or cost and fines.
And number 5, this is a particular point given that we are using a private entity right now for electronic monitoring. It would make EM for 1543A and be available to all defendants and not just those who can afford it. I have a little bit more on this. Currently, the use of the private agency for the purposes of electronic monitoring in 1543A and B cases has raised concerns among the group that the expense of the monitoring for the defendant creates a 2-tier system. Those who can afford the fees to get electronic monitoring, and those who can't have to go to jail. And due to the high costs of the private EM, it places the county in competition with the private agency in collecting our own fines and costs. Because they must be paid or the bracelet comes off and they go to jail. So their inclination would be to pay the private firm first.
And they have a series of,
This is how much, these are just some of the fees, I don't even have them all, but it's $11 per day. Most of the cases are at least 60 days, $100 hookup fee, there's a disconnect fee as well. They must visit twice a month, and that's $15. They charge 3.5% for paying on a credit card. Any change results in another fee, missed appointments, and even $5 for a document that's not turned in. So we estimate that the average defendant will be charged $800 to $1,000 for the electronic monitoring.
and that's exclusive. These guys don't collect any of the costs and fines over.
No.
Yeah, not one penny of that comes to Cumberland County.
$800 to $1,000 over what period of time?
60 days.
60 days.
In comparison to that, our electronic monitoring costs are $3.85 per day here. Typically, we've been charging offenders $10 a day for
Darby, additional charges over above the $10, or is the $10 inclusive of everything?
everything.
So you don't charge the hookup fee, they don't charge the equipment fee, so,
But we are talking about an expansion of the workforce that would have to administer this.
Correct.
So there's clearly costs involved.
Yes, absolutely.
Yeah, we have those coming up next.
Nice.
But the cost to the inmate that, or I'm sorry, to the defendant would be about $600 then.
Not when you add up all of the fees. I think it's
You said
$760.
$10 a day.
Are you speaking for adult probation or through the private agency?
Well, I don't know, I'm waiting to find out.
Through adult probation.
Is it gonna cost?
Yeah, that would be $300 a month for 30 days, that's correct.
Okay, for 60 days would be 60. Go ahead, I'll ask him some questions after you conclude.
But just to build off that, I mean, that figure is, that $10 figure is something we put out, that's not, we set that. I really don't have an issue with providing a service here with charging the offender the $285, and then that amount can be adjusted.
At the time that those costs were set, the EM equipment itself was more expensive. The $385 is a considerable drop, so that's something that the committee was going to tackle next. What is an appropriate charge for using the new updated equipment? Okay, these are the investments that we feel are needed. We would want one new probation officer to monitor and supervise the electronic monitoring and house arrest of the 350 defendants over the course of the year. We'd be asking for 3 part-time restorative sanctions assistants to provide the service of placing the 450 DUI and DUS defendants on electronic monitoring. And they would provide the administrative supervision of the 100 DUS cases. Because these are summary offenses, adult probation is not traditionally involved in supervision of those. These are cases that would be coming from the MDJs. And normally, they would not have much oversight after being sentenced at the MDJ anyway. So administrative supervision with notification to the court that any violation had occurred would be how the driving under suspension cases would be handled. They don't require drug and alcohol evaluations or anything like that. We would be seeking 1 additional drug and alcohol case manager to perform the 350 DUI evaluations needed for the expanded IP. So here's the cost benefit as we see it, both with and without the 1543As. And the reason I wanted to present that in 2 parts is because we are still working out with the judges whether or not they will allow the 1543As. I think that it is moving in that direction, but in the event that they would decide not, I did with those and without those for consideration. So.
And I'm sorry, when the Judge Dockery and Judge Hess got together, came up with the idea of using Keystone, was that for both A and B or just one?
They originally had wanted both. There's some discrepancy in how the law is being interpreted, and that's what's being resolved right now. So the total of the investments, the positions that were talked about in the previous slide, is $203,017. If we pursue a portion of those positions in the intermediate punishment grant that is to be submitted shortly, potential offsets from that grant are $55,805.
So annualize this.
Yes.
And that is not the MacArthur.
No, this is the county IP grant.
And you're saying that that's guaranteed, that we're...
No, I was going to get to that.
Go ahead.
And we included an offset from the evaluation fee revenue at a charge of $75 per evaluation, 350 evaluations a year. So if we look at those costs with the bed day cost diverted with including the 1543As, the total was from the original slide, $747,860. If we do receive the grant award in the total that we're applying for, and we include the revenue from the fees, the offset, the cost diversion for that would be $626,897. If we do not get the grant, then the offset would be $571,092. And I should say, we will get the grant, but whether they award us and don't reuse like they did last year is the issue. Similarly, the bed days without 1543A, that brings the total cost diversion down to $639.45, with investments in the grant offset $518,522. With investments in no grant, $462,717.
So, I have a question, again, we're all thinking on you. We talked about the offset from the stuff that's coming in for warranty and stuff being an offset. With this reduction, this total amount of bed days, this reduction in bed days, do you see that as sufficient enough to, say, warrant shutting down a unit within the prison, or
No. I don't think it'll rise to that level. But it will reduce bed days. And it will reduce, risk. And I don't really comment, I've been thinking of what Commissioner Eichenberg has said about that, the medical costs. That $72.25 a day is probably inclusive of the medical cost, Commissioner.
Okay.
Because our contract with the medical provider is a set amount. And then, short of anything catastrophic happening to a person.
So it's fixed cost, not per person?
Correct.
Okay.
That's like a fixed cost. And then if something catastrophic should happen to the inmate, then that's over and above what that line item cost is.
Okay, so it's already baked in.
Right, so that's a fairly accurate number.
I like to use the term diverted, cost diverted, as opposed to savings, because by putting a program like this in place now, what you're doing is setting the stage for actual savings as time goes on. As our caseloads grow, population grows, by sort of baking this into the cake now, that's real savings down the road. There are certain diversionary savings immediately. But I wasn't purporting to provide an actual savings right off the bat.
So, can you hear me? Earl? Sorry. So when if this plan were to be implemented, okay, it's not enough reduction in days to warrant a reduction in the number of units. We all know you can't shut down the front unit open or it's normal. As we come into our monthly prison board meetings, and you give us the average daily census, would that number of
Yes.
stuff come down?
It should drive down the average daily population.
Okay. So the real cost diversion here is in the operating expenses, the maintenance of prisoners in the prison.
Correct.
Clothing them, feeding them, providing them with services.
How many of these positions are bargaining unit positions?
One,
Just the
Just
probation
probation
officer?
officer.
Yeah, okay.
the restorative sanctions assistants, I wanted to expand on that a little. Right now, we currently have one part-time female employee who does the female drug testing. And then Paul Polensky, who is pretty much the full-time treatment coordinator, but also does the male drug testing. That program, we talked a little bit about this when my previous employee in the part-time position left, and there was a gap of time where we couldn't perform the female testing. It is essentially set up for failure in that anytime the person is off or there's a gap in service. By providing the 3 part-time positions, it makes not just sense on the electronic monitoring side, but it makes the drug testing portion of it fully functional. We're currently talking with Children and Youth Services about taking over all of their drug testing. And that's a heavily female population that they test. It's about 75-25, the exact opposite of the criminal system and the gender that gets tested. So Paul would be able to supervise the EM drug testing program and become more fully engaged in the treatment court if we were to have that set up. So it does benefit as well. I mean, we're up to over 7,200 drug tests per year with a part-time and full-time employee. So it's getting kind of difficult to do anymore than that.
So those 2 part-time positions would be under your
They would be
supervision,
IP
and they would
programs.
be non-bargaining.
Correct.
Okay, so you mentioned at the very beginning, Rebecca, that the cost of these bracelets has gone down.
$385 a day, and I believe they used to be close to $10 a day in the very
Do
beginning.
we buy them, so do we lease them?
We have a mix of both, don't we?
Currently, we have 20 units that were purchased about 4 years ago. Now, they're the older model, the RF models. had said earlier that the technology has gotten there. These are old technology where we had to go to the house, actually hook up the unit, and call BI to test to make sure it's working. With this new GPS unit, we don't have to do that. So we use some of those newer GPS units in our IP programs, and we have these RF units that we very rarely use because of
So do we buy these, or do we?
It
and
makes
is
more
the cost-
sense to rent them, I think, at this point. We did at one point buy ones that we could dedicate to the IP program, because we had the grant funding at that time to do it.
Okay. And did they come in different colors to allow for accessorizing?
They only come in pink.
I'm staying on zero.
All right, so, first of all, yeah, I just want to say, I support the concept of, if folks don't need to be in jail, these are non-violent offenders, it helps them to essentially still pay a price for their offense. I don't have a problem. I think, we want to move toward, alternatives to jail for those who don't need to be there and don't need to pick up the bad things in the prison. But, having said all that, I'd like to see a spreadsheet on this in terms of actual savings versus, cost conversion. And I would like to see relative to this $3.85 a day.
That cost is borne by the defendant.
Right. Okay. What I would like to see is also an analysis on how the rest of this is going to be borne by the defendant as opposed to the taxpayers. So, and I'd like to see a comparison of that versus what we're currently paying, this private company.
We pay the
don't
private
pay-
company nothing.
The defendant pays those costs.
Okay, so I'd like to see a comparison then between what, how we're going to make this work versus what the inmate is currently paying the private company. So I'd like to personally, I would like to see us, because what I'm hearing essentially is that, and I understand what Earl is saying, is that it's going to take less pressure off the prison system, but I don't really see any hard savings other than food and clothing, which I'd like to see those cost savings analyzed somewhere as to what those savings really are at the prison, because we're not going to be closing units down, as you indicated. And essentially, we still have to build in medical costs regardless. The only additional savings we might have would be is that there would be a significant medical situation for these folks.
We negotiate the contract for the medical provider, that those contracts are always negotiated based on an average daily population range. 250 to 300, 350 to 400, things like that. So Larry, hit a key point. We just keep chipping away, trying to drive that average daily population down. Food service is negotiated in the same fashion.
I think it would be pretty easy, straightforward, to come up with a more detailed breakdown of this. I think on a conceptual level, this certainly is appealing, but I think you have to go down into the weeds. And I think when you do that, it'll validate the concept, but I think it's more persuasive. I mean, the obvious place, the first thing you think of, well, we need less COs. That's not the case. But the cost of keeping someone in prison is those, the sum total of many, many factors. And the what we'll call operating costs are not insignificant. I mean, that's sort of the basis upon which we charge Perry County for female prisoners and stuff like that. Then I think there's this whole question of, I don't think you're proposing to take the entire burden, clearly not the entire burden, off the defendant. Clearly, and I'll speak bluntly here, this is a cash cow for this private enterprise. I mean, they're dinging it every second. And whether you have any sympathy for the defendant or not, from a strictly self-interest standpoint, it means that that's less money they have available to pay the county the cost of fines that it owes us. You know, they're gonna pay those guys first, or otherwise, because you're kind of locked into like a really bad credit card deal. You know, the interest just keeps piling and piling on.
And you will not see those numbers, because not everybody can afford that regardless.
Right.
And that's the other part, there's much fewer offenders who can take advantage or will take advantage of it. And so you're going to continue to see that at the prison because they can't afford this.
And I think like the historical evolution of this is that, you know, Judge Docker and Judge Hess said, let's reduce the prison population. There was a solution readily available in the private sector. It seemed like it was really good, and it's good aspects to it. But when you look very closely at it, it has a price tag on it that, as you mentioned, kind of creates a two-tier system, which then does two things. It means that we still have a whole bunch of people in jail that wouldn't, if they could afford this kind of service, wouldn't be in jail. So we're missing out on those things. And you divert it for the population that can afford the service, okay, assuming they're not multimillionaires or whatever, or, you know, making over $75,000-$80,000 a year. Their discretionary income is going to go to pay all those fines and less be available for costs and fines for the county. And there's no impetus other than what AP can provide working with those people. There's certainly that agency Keystone is under no obligation whatsoever to help us with our collection of our costs. So, I mean, I think it was a great idea, but just like anything else, when you see how it works out in practice. If you can save the county more money by internalizing those, both in diversion and, you know, in these other ways, it's certainly something worth considering.
We need a full account of what those costs are to make that head-to-head judgment. So I think that's what our need is going forward. So I agree with what Jim said about the spreadsheet. Some of these, there's some assumptions built in here, especially up here where we're getting to the 10,351 number, if I heard that correctly.
Right.
So I think we might want to dig into those a little harder. The question I
Those
had,
are based on actual sentencing data for the last 4 years. Those are the numbers with
All right.
conservatively reduced.
yes, I did hear that. Okay. All right. When is the last that we first introduced the diversionary stuff about 10 years ago, I guess, and at the time, there was, I think, a great deal of emphasis put on about, you know, measuring our results and everything. What's the last time we had received an attentive analysis on the data?
Last year in the early spring, the Pennsylvania Commission on Crime and Delinquency came and presented their recidivism study, and we were
Yes.
the lowest county in the state for recidivism. We have a very low recidivism rate as compared to anyone else.
And that's
Okay.
attributable to,
To the program, I believe.
Well, I guess I'd like to understand a little more direct connection between that number and the diversion aspect, which was merely to make people essentially pay their debt to society through alternate means other than sitting in a cell. So,
I can certainly run the reports out of the system for you if you'd like to see.
yeah, I'm sure we have it here, but I'd like to take a look at and see.
I think
if
you can
we're-
put all that stuff together.
Yeah, I want to make sure the reporting is robust enough that we can, you know, extrapolate this toward those expanded programs.
Yeah, there is that part of this. It's not all, you know, it's not all about dollars and cents, but I think it is helpful to try to drill down and see what we're talking about, you know, dollars and cents. Because if we reduce recidivism, essentially, that's also saving lives and also other, but, you know, that's a little more difficult to, you know, put a dollar figure on. You can't put a dollar figure on that. But, you know, on this, you know, I think I'm interested in knowing exactly, so what is the additional cost involved in what we're describing as an investment, you know, so that we know what we're talking about. I heard, you know, mentioned about a backlog in the courts. Okay. I mean, how much of a backlog are we talking about? You know, is it, have to have another judge. You know, those are questions that I'd like to, maybe understand.
It means that some days people are here till 6 or 7 o'clock at night getting through the court list, things like that.
Okay.
I don't think anybody at this time, Melissa, is suggesting we need, well,
The bench is not currently asking for another judge, but I can tell you, and it's mostly anecdotally because it's so dependent on different factors, it takes a little longer to get things done these days. As the caseload continues to grow, we still only have 6 judges, although the 6th one just came on recently. The smallest third-class county, which is much smaller than us, has 9 judges. Whether they do a better job with 9, I can't say that. I think we do pretty good with the 6 that we have. But there is going to come a point, if the caseload continues to grow, that 6 judges cannot do what needs done every week in the 5 days they have available to them.
So if this helps to reduce the backlog or improve scheduling or whatever, those are important things.
It is important, because if you're looking at 75% of the 50 cases on the list, I'm not really good at math, so tell me what that number is.
It's true.
35, 40 of the revocations that are coming in, 35 or 40 people, their attorneys, probation's involved, the judge has to take the time. They only spend 10 minutes. How long is a revocation hearing take? 30.
If we don't take any testimony?
Say no testimony,
10.
shortest one, 10 minutes, that's 35 defendants, somebody do math. That's a lot of time. That's that much time that a judge isn't spending
The most
on.
frustrating thing is you're churning
It's-
people over and over and
Yeah,
over.
because they're
again.
scheduled to come back again. So in
Yeah.
30, 60, 90 days, that same defendant that the judge just spent 10 minutes telling you gotta go get your drug and alcohol medication is back in
So
again.
it's a waste of everybody's time. So it's
Basically, but it has to be done.
Overtime for the sheriff's department, so that zero to no.
When court runs till 6 o'clock at night, sheriff's department doesn't get to go home. And you can't just say, okay, at 4:30, everybody we didn't get to come back next Tuesday, because next Tuesday's list is just as big as this Tuesday's was. So you've got to finish the list. So that's overtime on the process.
Okay, so this is all about improving efficiency.
Yeah.
Okay. Now, you mentioned something about children youth services and working with children youth services for drug testing. Or something?
they had approached us and they've been trying to make their program more robust. And currently, they have a couple staff members assigned to do that. But the way it works, that often, I think that their staff has to go out to the person to have it done. They don't have the same kind of availability and randomization that we have in our department. So we've been discussing that. They're providing us with data on what their testing costs per year are, which they could transfer what they pay in supplies to our program to be able to accomplish that. But
And it
it's
frees
just
up their staff
preliminary.
who's with these new 23
Yes.
new laws and this wonderful new computer system. It's taking a lot longer to do more cases than they have.
So is one of these new staff people going to be potentially handling the drug testing that's currently being done outside by children youth services then? Is that
Correct.
what you're saying?
We should be able to accommodate them if that's the case.
And how does that fit in with DA's forensic grand plan of bringing most?
Well, it doesn't change the operation of the drug testing program. It merely changes who we send the tests out to for confirmation when they're
Somebody
positive.
has to collect the fee.
Yes.
Well, maybe this is something that, though, relative with children youth service could be factored into the cost savings.
We have discussed that, whether or not in their next budget they could build something into it, but the way that their budget is done 2 years in advance, we're stuck with the budget that they have now. So,
But, I mean, we were just over there talking to them about, we had a contingency plan to put an extra person on call over the weekend, because again, since the first of the year, they've been, the caseload has gone up dramatically. And to the extent that you can, this is not a silver bullet, it doesn't some of the stuff, the increase in the number of cases they have, the time it takes to review the cases with this new computer system, it takes pressure off them and allows them to redirect staff back to their core functions. And I'd rather have them doing case management than, no offense intended, collect fees.
One of the things that was discussed earlier, and it's been discussed before too, is while we may not be able to reduce, how many folks are down there taking care of people, a key part of this is we don't have to expand it either, even though we've got the blocks there. Do we have, there's certainly got to be a tipping point at which that decision is made. Do we have a fixed number at which point we know we've got to expand into blocks?
Yes.
Okay.
I don't have that off the top of my head, Commissioner.
Yeah, I would expect you to.
But we have what we call red numbers that,
Okay.
Their staffing report that they provided, I think, like 6 months ago, has those
Right.
stair points in it.
Okay, well, they truly are a tipping point because of that, when you hit that number, even close, now you're talking about significant introductory expenses, so it would help for us to see.
you're thinking
how
about
close
the
we are.
jail, you talk about classification, which is a close confinement cell. Typically, if you have somebody in a close confinement cell, you ought to have a bed for them somewhere else out in the jail. So when we talk about operating capacity, I try not to include those close confinement cells. Because once those numbers include those close confinement cells, you're in those red zones.
Okay, let me follow up on this with a question. I see D.A. Freed's name on here, so I'm assuming this has the support of his department.
He was going to try to be here today.
Okay,
if he could.
that's fine, I understand his schedule's very full. The reason I ask is because over the weekend, I heard comments from an ADA who basically complained, saying, we build all this prison space and they won't let us fill it up. They won't let us prosecute these people. And so that just raised the question with me, is that department on board with diversion, or are they not on board? Is that just one person expressing an opinion, or is that a reflection of other comments we've heard?
That's one I haven't heard before, and I don't want to speak for Dave, but I have never gotten that impression.
They build it,
in
they
any
won't let us use it.
meeting.
The comment was, they build it, they won't let us use it.
And we
Dave
talked,
just fully supported the MacArthur grant submission. That is all about not overusing incarceration, so I think that speaks for itself.
you have a couple of fundamental contradictions that are built into the system. You have DUI legislation, which I believe has mandatory sentences, right? There ain't no discretion, you gotta do it. You gotta do it if the person had 2 years, 6 years, or what have you, okay? It was knee-jerk reaction, this is my editorial comment, to Mothers Against Drug Trials, okay? Now we have this thing just like we have the Sandusky legislation. No money to fund any of this stuff, yada, yada, yada. So the counties are left to do that. On the other hand, you have the quote law and order folk who think that, if you build a prison, we will come. And I think when I reviewed the county strategic objectives for 2015, I honestly think that, between public safety and prison system, we have an issue of overcapacity. We built too much when in previous administrations they were flush with money. And the temptation in those kinds of overcapacity systems is always to generate more demand for the services to meet the existing supply. The problem is that you generate all these marginal operational costs. In doing that takes your cost structure and throws it totally out of the filter. Now, if there are people out there, whether they're in ADAs or in the police departments or in the League of Women Voters, who thinks we should be throwing every DUI person in the clink for 90 days, they're entitled to that opinion. On the other hand, we're the ones who bear the cost, and most importantly, it's the data that shows what really works about both protecting society and distributing our costs.
The missing component too in this is a long-term perspective, because when we sized the prison expansion, the idea was that sized for 25 to 30 years out. When we bought Allen Road, the idea was that's sized for future expansion, and hopefully we can lease some of that space in the meantime. The same idea has been discussed for prison, but has never gone forward for a variety of reasons. Same with any of the other excess capacity that's been derived around here. We know we're a growing county, and rather than just plan for today, sometimes you plan for tomorrow too. But the perspective, at least in this case, seems to be somebody who sees that empty space and wants to fill it. Now, I'm not saying that's representative of the department, of the DA's office, but I'd like to know that that's truly not the perspective of at least the decision makers of that department. So,
No, I mean, at the prison board, Dave was with me when we presented the
Okay.
concept of
that's very
this.
reassuring.
Yeah, I was gonna say the same thing. I remember the DA at the last prison board meeting, was more or less being very supportive of moving forward with this diversion program, intermediate punishment. So, yeah, I could say a lot about the $31 million prison expansion project that, added several millions of dollars to our debt service cost, and whether or not it was a good move. And we can all play 2020 hindsight here. I wasn't here when that decision was made. I wonder today whether that decision would be made again. Fact is that the number of inmates that we have, somewhere around the same level when the ground was broken on the prison in 2008. So,
Again, it's a long-term perspective. That was the entire plan.
yeah, and our taxpayers today are paying for it.
Well, they're paying for a nursing home expansion, and we're not mandated to have a nursing home.
No, they're not.
We are mandated
No,
to
they're
have a
not. The
prison.
taxpayers are not paying for the nursing home expansion.
Just they.
No, they aren't. We got a $3 million fund balance, and not one dime of taxpayer dollars.
It's another argument.
That needs to be corrected, and, we needed, quit saying things that aren't true.
Next week, we're going to
Recognize all
have
the true costs involved.
next week, we're going to have a presentation on nursing home diversion. For people, nursing home.
Well, what I would like to ask of you today is whether you are comfortable enough with the idea to allow me to submit the grant, including the portion of the probation officer and the pre-restorative sanction positions in it. Now, if for any reason moving forward, you would decide not to pursue this, I could always, if we are awarded the money, file a project modification request to utilize the money in some other way.
We have escape hatch along the way for this decision processes. So
How would you vote separately to accept the grant once it's awarded?
Yes, it will, because we were presenting the idea to you now, the grant, I think, will be on for approval April 9th at the workshop.
How much time would it take us to put together the spreadsheet with a full cost analysis?
I have a full spreadsheet right now. It just wasn't very pretty. I wanted to make it more understandable for somebody looking at it for the first time, but it does not have some of the finer details that you would like added.
If we sort of had a conference call on Monday, or Tuesday, whatever, okay, and kind of just went through that and pooled our collective notion of what the commissioners are looking for there, we see how much we have there. But as long as there's an escape clause in there, if for some reason it proves not to be viable, then you can at least plan appropriately.
I mean, conceptually, I like this, but I think we need to finer point on some of the numbers to make them comfortable with the numbers.
I think Commissioner Eichelberger and I agree.
There you go.
All right,
Can you write that down?
Yeah. I might need CPA